Uncompensated care in Wisconsin hospitals in 2021 was $1.29 billion. That figure comes to us from the Wisconsin Hospital Association's annual Uncompensated Care report. Uncompensated care is a combination of bad debt and charity care dollars. In 2021 in Wisconsin, $536.6 million was charity care and $751.1 million was bad debt. On the screen, we show you the trend of uncompensated care in Wisconsin over the past several years. It's been an upward trajectory for the past several years, since 2015. There's a slight dip in 2021, and that's over the $1.36 billion of uncompensated care in 2020. But the trend of charity care and bad debt is more concerning. Bad debt for Wisconsin hospitals increased by $8.4 million over 2020, while charity care services provided decreased by $84.2 million over 2020. And if you compare the number for 2021 to pre-pandemic year 2019, it's actually a decrease of $94 million. We show what the trend looks like as that widening gulf between charity care and bad debt continues to grow. That widening gulf between charity care and bad debt in Wisconsin is a grim omen for low-income patients. In a statement, Bobby Peterson, public interest attorney at ABC for Health, says hospitals aren't getting paid either way. But while charity care helps communities by erasing medical debt, accounts labeled as bad debt can lead to damaged credit scores, lawsuits, and other harms to patients. Increased medical debts are huge health equity issues and major stressors for health disparity populations in Wisconsin, and patients endure the barriers of medical debt. Like we said, harassment, court summons, and default judgments. Disparity families are unequipped to challenge debt actions alone. They suffer wage garnishment, family stress, and disrupted access to care. And Peterson says we need to instead apply common sense strategies to help these patients prevent certain debts. The real winner in the continuing growth of medical debt and uncompensated care is the collections agency. The industry, not the hospital, profits from the misery of many low-income, credit-compromised consumers. And unfortunately, most hospitals gladly transfer their debt to long-standing business partners in collection agencies and law firms. So here are some solutions. Proactively helping patients at the start of the healthcare services process. Engaging trained, skilled staff at the hospitals. Knowing the federal charity care rules and regulations, uncomplicating the charity care process, and including strong consumer assistance and protections, among others. You can read the Wisconsin Hospital Association's Uncompensated Care report. We link to it in the description below, along with more on the inequities of medical debt and collections actions in Wisconsin.